and surgery are the main way of treating cancer. Give you an example. For example, for a lung cancer, and we use non-small cell lung cancer. The surgeon remove that cancer, and after that they say, oh, there is some cancer in the lymph nodes. Or before that happened, before the surgery, from the beginning, we know the cancer there is in the lymph node. So we say no more. No, there is no need for surgery. So we treat that cancer with radiation therapy concomitantly with chemotherapy. Chemotherapy is blind, doesn't have eyes. It attack the cancer. We are not sorry that's what we're trying to do, but unfortunately, chemotherapy does affect normal tissue. Anything look like cancer can be affected by chemotherapy. Like what? Hair look like cancer because it grows fast. So people on chemotherapy, not all kind of chemotherapy, but most chemotherapy drugs does cause hair loss. Also, it kills the blood, the white blood, which fight the infection, red blood, which give us the energy, platelets, which prevent the bleeding. Those are the blood.
So all these are side effects
of the chemotherapy. There is immediate side effects. We hear, horrible things about chemotherapy from years ago, like chemotherapy, nausea, vomiting, not able to eat. I would say not anymore,
but chemotherapy is not the same thing. You have like different degrees, like from 1 to 5. I heard
there is different drugs. Each drug has a specific type of side effects. I would like to mention that nowadays this decade actually is a decade for good news for cancer patients, because nowadays we do have new drugs, non-chemotherapy drugs. We call it target therapy. Like,
is it as effective as
yes, I would say yes. It is like a smart bomb. You just drop it, it goes only to the cancer cell. So scientists in the lab, they're able to identify some target or markers in the cancer, and they develop drugs just only goes to that target.
Is it less side effects?
Less side effects.
You're not going to lose your hair? Or?
No, because it only goes to the cancer. The problem is it's new. We're just learning, but I mean there is few of them. I'll give an example. There is something called Herceptin, which is for breast cancer. Side effects are very minimum. There is some concern that it may affect the heart, but it's only 1 to 4 in 100. I mean, maybe about 2 to 3% chance that it may affect the heart. But it does not cause hair loss, no nausea, no vomiting. It is very specific, only goes to the breast cancer cell.
You know, cancer has been around for a long time, but I'm surprised, 2006, and with the advancement of technology and medicine, but still we don't have 100% cure for it.
I agree. I mean, we don't have cure for cancer, but we're trying to move the cancer from a deadly disease to a chronic disease. Now I consider my patient with breast cancer has a chronic disease, like someone with diabetes, with heart failure, with emphysema. They never cured from this.
Is there pain with cancer?
Yes. At the end stage of cancer, when the cancer spread, especially to bones, it does cause pain. So it depends on what. Say, for example, cancer hiding in the lung doesn't cause pain, but if it goes to the chest wall, to the ribs, goes to the back, it does cause quite a bit of pain.
Is there any, you said to the back, spinal cancer?
Yeah.
What are the causes?
Usually, cancer goes to the spine. It has to be. It goes to the spine. So it has to be coming from somewhere else. There is some cancer arise in the spine, but that's not the common scenario. Usually, cancer in the back. Someone say, she or he has bone cancer. Really, it is not bone cancer. It is a cancer that came to the bone. From somewhere, from breast cancer that show up in the bone, lung cancer that move to the bones. Usually that's the case. There is, of course, bone cancer, definitely, but there is usually that in kids, teenagers, there is some kind of bone cancer. But when people talk about bone cancer usually talk about cancer that came from somewhere else. So it does not originate from the bone itself. It came to the bone from somewhere, and that's why I say my mother or my father died with bone cancer. Usually it is a cancer that is either in the prostate, which is usually goes to the bone, breast goes to the bone, and can we cure that? Of course not. Once the cancer goes to the bone, we don't cure it, but we can manage it, we can control it, and so we can. I mean, there is some medicine that can help for the pain, some medicine that stabilize the bone, prevent fractures. So there is something can be done about it, but of course not cure.
Even with the smokers, sometimes we tend to see that there is a lot of darkness in their mouth, and I'm sure there is maybe some kind of cancer, even like a gum cancer.
Yes, that's actually, I'm glad you brought that. What we call it head and neck cancer. That means
head and neck cancer.
Cancer. When we say head and neck, we mean cancer of the throat, starting from the lips down to the larynx or pharynx down in the throat. Those cancer it's going to be very, very unusual to see that type of cancer in someone who does not smoke, does not drink. So two together. And I should mention that when you ask about alcohol.
Right.
Yes. I'm glad you mentioned you brought that. Alcohol and smoking together equal head and neck cancer, and that is really very bad type of cancer, because you talk about this small box, you swallow through this box, you talk through this box, and you breathe through this box. So imagine if there is a tumor sitting there. It is.
Wow.
I mean, if they do surgery or if we treat, that means you lose voice. That means problem with swallowing. People end up with having a tube
and breathing too.
Yes. And then breathing, and then we just make an opening in the throat for breathing. So smoking and alcohol does cause throat cancer.
How about second-hand smoker?
They're the same. If you live with someone who smoke, you smoke.
So how can you get rid of your spouse?
Well,
some people are willing to get rid of their spouses, but not the cigarette.
If someone smoke in the house, they don't. That means the other person doesn't smoke too.
The best advice: if you want to smoke, if you have to smoke outside. Please, let your spouse and your kids live healthy and a longer life. Let's go back to the issue.